Discriminated, depressed, and disillusioned. Margaret Ario, who is HIV positive, walks to Panyangara Health Center 3 in Kotido district to receive antiretroviral drugs. She contracted the virus from her husband, who later abandoned her with 2 children. Sadly, one of her children passed away.
When that child died and they realized it was because of HIV/AIDS, they had to dismiss her from home. The parents chased her out and she was very sick and very ill at that time.
Ario narrates that community members shunned her and considered her a curse in society. Disowned by her own, the 26-year-old retreated to the wilderness, where she was rescued by medical workers.
She was having frequent attack of diarrhea. She could not eat. She had a cough. She was really very weak, almost bedridden.
She was rushed to the health center and given antiretroviral treatment. Although her life is returning to normalcy, Ario still remains an outcast in the community.
They chased her. The parents didn't want her to go back home. So they had to give her accommodation from the quarters because there were some free houses.
Ario's ordeal is shared by many HIV-positive Karamajong, especially those living in rural areas. Although the health officials in the region continue to preach tolerance towards those who are HIV positive, the community here, which is largely primordial, believes an HIV-positive person is a curse.
With the knowledge of HIV just becoming a reality in our communities, stigma is quite a big problem. And stigma goes a long way in affecting actually how the HIV counseling and testing of our patients.
Not only are the HIV-infected persons emotionally scarred.
I take medicine, then support for medicine is not there. Then what can I do? Anger.
Reach You, a project under Makerere University Joint AIDS Program, has partnered with health centers in Karamoja sub-region to educate the communities on caring for those with HIV/AIDS.
We've tried to encourage the people to avoid discrimination and encourage disclosure amongst the couples. So through the health centers that we've supported through logistical management and support, we ensure that they can reach out to these communities with HIV counseling and testing and other additional services like family planning, nutrition and sanitation.
The program also provides testing kits to health centers and also extends HIV/AIDS counseling services to the community. The HIV/AIDS campaign is on here in Karamoja. In fact, Margaret and her colleagues teamed up to form a drama group going from one village to the other, preaching against discrimination and stigma. They're also encouraging many to turn up for voluntary testing and counseling. When HIV/AIDS ravaged the country in the 1990s, the prevalence rate in Karamoja was low, but it has since then shot to 5.3%, short of the national prevalence rate at 7.3%.
Transactional sex has become quite very common here, and that is proving to be quite a challenge, and that's why we are registering quite an increase in the prevalence of HIV.
Condom use in the sub-region stands at 13.5%. With the community which rarely practices safe sex methods, there are fears that unless the community engages practical methods to combat HIV/AIDS, the scourge will continue to spread in Karamoja. Serwanjja, NTV.